Hello, friends, and welcome back to Kind Care Seniors. I'm Dr. Emily Carter, and today we're going to have a conversation that many men need to hear, but few are comfortable talking about. Erectile dysfunction after 60. Now, I know this topic can feel uncomfortable or even embarrassing, but here's the truth. Erectile dysfunction is incredibly common as men age. It's nothing to be ashamed of. And, most importantly, there are genuine solutions that can help. Whether you're experiencing these challenges yourself or you're watching this to better understand what a partner or loved one might be going through, I'm glad you're here. Today, we're going to have an honest, compassionate, and medically accurate conversation about what causes ED after 60, what actually helps, and when it's important to see a doctor. Let's talk about it. The conversation we need to have. Let me start by acknowledging something important. For many men, erectile function feels deeply connected to their sense of masculinity, confidence, and identity. So when things start changing, when erections become less reliable, less firm, or more difficult to achieve, it can feel devastating. Many men experience shame, embarrassment, anxiety, and even depression. They avoid intimacy with their partners. They withdraw emotionally. They convince themselves they're too old for sex. And they suffer in silence, never talking to anyone about what they're experiencing. But here's what I want you to understand. Erectile dysfunction is not a personal failing. It's a medical condition with identifiable causes and effective treatments, and it's incredibly common. Studies show that about 40% of men experience some degree of ED by age 40, and that number increases to roughly 70% by age 70. You are absolutely not alone in this. So let's break down what's really happening, why it happens, and what you can actually do about it. What erectile dysfunction really is. First, let's define what we're talking about. Erectile dysfunction means the persistent inability to achieve or maintain an erection firm enough for satisfactory sexual activity. Notice the word persistent. Having an occasional issue doesn't mean you have ED. That happens to virtually every man at some point. Stress, fatigue, alcohol, distraction. Lots of things can occasionally affect performance. ED is when it becomes a consistent pattern that affects your quality of life and intimate relationships. It's also important to understand that ED exists on a spectrum. Mild, occasional difficulty, but mostly functional. Moderate, erections are less firm or harder to maintain. Severe, unable to achieve erections suitable for intercourse. Where you fall on this spectrum helps determine the most appropriate approach. What really causes ED after 60? Now let's talk about the actual causes. This is where understanding the biology really helps. Achieving and maintaining an erection requires several systems working together. Your brain needs to send the right signals, nervous system. Your blood vessels need to dilate and fill with blood, vascular system. The muscles around the penis need to relax, smooth muscle function. Hormones need to be at appropriate levels, endocrine system. A problem in any of these systems can contribute to ED. And as we age, multiple factors often combine. Let's break down the major causes. Cause number 1, vascular issues, the most common. This is by far the most common cause of ED in men over 60. An erection is essentially a vascular event. It requires good blood flow into the penis and restriction of blood flow out. If your blood vessels are damaged, narrowed, or stiff, this process doesn't work well. The same things that cause cardiovascular disease also cause ED, high blood pressure. High cholesterol, atherosclerosis, hardening of the arteries, diabetes, smoking. In fact, ED is often an early warning sign of cardiovascular disease. The blood vessels in the penis are smaller than those in the heart, so they show damage earlier. If you're experiencing ED, it's worth getting your heart health checked. It could literally save your life. Because number 2, nerve damage, neurological. Nerves carry the signals from your brain to your penis that initiate an erection. If those nerves are damaged, the signals don't get through properly. Common causes of nerve damage include diabetes, diabetic neuropathy, prostate surgery or radiation, spinal cord injuries, multiple sclerosis, Parkinson's disease. Cause number 3, hormonal factors. Testosterone naturally declines as men age, about 1% per year after age 30. While low testosterone alone rarely causes complete ED, it can contribute to reduced libido, sex drive, less firm erections, reduced energy and motivation. It's worth checking testosterone levels, but it's often not the main culprit. Cause number 4, medications. Many common medications can contribute to ED as a side effect. Blood pressure medications, especially older types, antidepressants, particularly SSRIs, antihistamines, prostate medications like finasteride, some pain medications. If you started experiencing ED after beginning a new medication, talk to your doctor. Often there are alternatives. Cause number 5, psychological factors. While physical causes are more common after 60, psychological factors absolutely play a role. Performance anxiety, what if I can't perform? Stress and worry, depression, relationship issues, past negative experiences. Here's the tricky part. Even when ED starts from a physical cause, psychological factors often make it worse. It becomes a cycle. Physical difficulty leads to anxiety, which makes the physical problem worse. Cause number 6, lifestyle factors. These directly impact vascular health. Obesity, lack of exercise, poor diet, excessive alcohol consumption, smoking, insufficient sleep. The good news? These are modifiable. Changes here can make a real difference. When ED is a warning sign, this is crucial. Erectile dysfunction can be the first sign of serious health problems, particularly cardiovascular disease. If you're experiencing ED, especially if it came on relatively suddenly, see your doctor for a complete evaluation including blood pressure, cholesterol levels, blood sugar/diabetes screening, testosterone levels, cardiovascular assessment. Many men discover they have high blood pressure, prediabetes, or early heart disease through an ED evaluation. Addressing these conditions not only improves erectile function, it can literally add years to your life. Don't let embarrassment prevent you from getting checked. Your doctor has heard this before, many, many times. It's a routine part of men's health. What actually helps? Evidence-based approaches. Now let's talk about what genuinely works. I'm going to focus on approaches backed by solid research, not internet folklore or wishful thinking. Approach number 1, lifestyle modifications. Start here. Before anything else, address modifiable factors. These changes benefit your overall health while specifically supporting erectile function. Exercise regularly. Physical activity improves cardiovascular health, which directly translates to better erectile function. Studies show that 30 minutes of moderate exercise most days can significantly improve ED. Aerobic exercise, walking, swimming, cycling, is particularly beneficial. Pelvic floor exercises, Kegels, can strengthen the muscles involved in erections. One study found that men who walked just 30 minutes a day had a 41% lower risk of ED. Improve your diet. What's good for your heart is good for your erections. Mediterranean diet pattern. Vegetables, fruits, whole grains, fish, olive oil. Reduce processed foods and saturated fats. Limit red meat. Include foods rich in antioxidants. Research shows that men who follow a Mediterranean diet have better erectile function. Maintain healthy weight. Obesity is strongly linked to ED. Losing even 5 to 10% of your body weight can improve symptoms significantly if you're overweight. Quit smoking. Smoking damages blood vessels throughout your body, including those in the penis. Quitting can lead to noticeable improvements in erectile function within weeks to months. Limit alcohol. While moderate alcohol, 1 to 2 drinks, may not be problematic, heavy drinking definitely impairs erectile function both acutely and chronically. Manage stress. Chronic stress elevates cortisol and adrenaline, which interfere with the relaxation response needed for erections. Find stress management techniques that work for you. Meditation or mindfulness, yoga, therapy or counseling, hobbies and activities you enjoy. Improve sleep. Poor sleep affects testosterone levels and overall health. Aim for 7 to 8 hours of quality sleep nightly. Approach number 2, medical treatments. When lifestyle changes alone aren't enough, medical interventions can be very effective. Oral medications, PDE5 inhibitors. These are the most common first-line treatments. Sildenafil, Viagra, Tadalafil, Cialis, Vardenafil, Levitra, Avanafil, Stendra. How they work. They enhance the effects of nitric oxide, helping blood vessels in the penis relax and fill with blood. Effectiveness. About 70% of men experience improvement with these medications. Important considerations. They don't create automatic erections. You still need sexual stimulation. They don't work instantly. Timing varies by medication, 30 minutes to 2 hours. They have potential side effects, headaches, flushing, nasal congestion, vision changes. They can interact with other medications, especially nitrates, heart medications. They require a prescription and medical evaluation. Many men are afraid of becoming dependent on these medications. Here's the truth. They don't cause dependence, but they also don't cure the underlying problem. They're tools that help achieve function while you work on addressing root causes. Testosterone replacement. If blood tests show clinically low testosterone, and you have symptoms, low libido, fatigue, reduced muscle mass, testosterone replacement might help. However, testosterone alone rarely solves ED unless low testosterone is the primary cause. Approach number 3, vacuum erection devices. These mechanical devices create a vacuum that draws blood into the penis, then a ring at the base maintains the erection. They're non-invasive, don't require medications, and work for many men. They do require some practice and coordination. Approach number 4, penile injections. For men who don't respond to oral medications, injections directly into the penis can be very effective. Yes, it sounds intimidating, but many men find them straightforward after the first few times. Approach number 5, penile implants. For severe ED that doesn't respond to other treatments, surgical implants are an option. They have high satisfaction rates, but are invasive and typically considered a last resort. Approach number 6, counseling and sex therapy. Even when there's a physical component, psychological factors often play a role. Working with a therapist who specializes in sexual health can help with performance anxiety, communication with your partner, adjusting expectations, finding new ways to experience intimacy. Many couples find that involving both partners in counseling leads to better outcomes. Natural approaches, what actually has evidence. Let me address natural supplements and approaches honestly. Most have limited evidence, but a few show some promise. Some evidence, L-arginine, an amino acid that may improve blood flow. Some studies show modest benefits when combined with other supplements like pycnogenol, Panax ginseng, Korean red ginseng, called the herbal Viagra. Some studies show improvements in erectile function. DHEA may help some men with ED, particularly if levels are low, limited or no evidence. Horny goatweed, yohimbe, and can have serious side effects. Maca root. Most other herbal supplements marketed for ED. Here's my honest opinion. If you want to try natural approaches, discuss them with your doctor first, but don't delay seeking effective medical treatment while experimenting with supplements that may not help. The role of communication. One of the most overlooked aspects of dealing with ED is communication with your partner. Many men withdraw emotionally and physically when experiencing ED, which creates distance and tension in the relationship. Their partners often feel rejected or assume they're no longer attractive. Open, honest communication is crucial. Explain what you're experiencing. Reassure your partner it's not about them. Discuss trying treatments together. Explore other forms of intimacy beyond intercourse. Many couples find that working through ED together actually strengthens their relationship and opens up new dimensions of intimacy. Realistic expectations. Let me be honest about something. Erectile function at 70 won't be identical to what it was at 30, and that's okay. As men age, erections may take longer to achieve. They may not be quite as firm. Refractory period, time between erections increases. Spontaneous erections decrease. This is normal aging, not dysfunction. The goal isn't to turn back the clock completely. It's to maintain satisfactory function that allows you to enjoy intimate relationships. Real patient stories. Let me share a couple of stories with details changed for privacy. Robert, age 65. Robert came to see me deeply embarrassed about his ED. He'd been avoiding intimacy with his wife for months, which was straining their marriage. We did a full workup and discovered he had high blood pressure and prediabetes, both previously undiagnosed. We started treating these conditions. I also prescribed a PDE5 inhibitor and referred him and his wife to a sex therapist. Within 3 months, not only had his erectile function improved significantly, but his overall health was better, and he and his wife reported feeling closer than they had in years. The ED was actually a blessing in disguise. It led to discovering and treating serious health conditions early. James, age 72. James had been dealing with ED for years but was terrified of medications because of side effects he'd read about online. We talked honestly about the actual risks versus benefits. We started with lifestyle changes. He began walking daily, improved his diet, and lost 15 pounds. After 3 months, he saw some improvement but not enough. We tried a low dose of tadalafil. It worked beautifully with minimal side effects. His response, "I wish I hadn't waited so long. I let fear keep me from getting help for years." When to see a doctor. You should definitely see a doctor if you're experiencing persistent ED. ED came on suddenly. You have other symptoms, chest pain, shortness of breath, dizziness. You're taking medications that might contribute. You have risk factors for cardiovascular disease. It's affecting your quality of life or relationship. Don't wait. Early detection can be a valuable early warning system for your overall health. What about prevention? If you're not currently experiencing ED, can you prevent it? While aging brings natural changes, you can absolutely reduce your risk. Maintain cardiovascular health, exercise, good diet, healthy weight. Don't smoke, limit alcohol. Manage chronic conditions, diabetes, hypertension, high cholesterol. Stay physically and mentally active. Maintain intimate relationships. Address stress and mental health. The same habits that promote longevity also support sexual health. The bottom line. Here's what I want you to take away from this conversation. 1. ED is common and nothing to be ashamed of. It's a medical condition, not a personal failing. 2. It can be a warning sign of serious health issues. Getting evaluated can literally save your life. 3. Multiple treatment options exist. From lifestyle changes to medications to devices to counseling, there are genuine solutions. 4. Communication matters. Talk to your doctor. Talk to your partner. Don't suffer in silence. 5. Aging doesn't mean the end of intimacy. With the right approach, most men can maintain satisfactory sexual function well into their later years. Your action steps. If you're experiencing ED, step 1. Schedule an appointment with your doctor for a complete evaluation. Don't let embarrassment stop you. Step 2. While waiting for your appointment, start lifestyle changes. Increase exercise, improve diet, reduce alcohol, quit smoking if applicable. Step 3. Have an honest conversation with your partner about what you're experiencing. Step 4. Be open to trying recommended treatments. Don't let fear of medications prevent you from getting help if they're appropriate for you. Step 5. Be patient. Finding the right solution sometimes takes trial and error. Sexual health is an important part of overall quality of life and healthy aging. It affects your physical health, emotional well-being, and intimate relationships. You deserve to have satisfying intimate connections at any age. And with today's understanding and treatment options, most men can achieve that. Don't accept ED as an inevitable part of aging that you just have to live with. Help is available. Solutions exist. And taking action, starting with an honest conversation with your healthcare provider, can genuinely transform your quality of life. Thank you for watching this conversation. I know it's not an easy topic, but it's an important one that affects millions of men. If this video was helpful, please give it a like and consider sharing it. You might help someone who's struggling in silence get the information they need. Subscribe to Kind Care Seniors for more honest, evidence-based conversations about health concerns that matter to older adults. And remember, seeking help isn't weakness, it's wisdom. Taking care of your sexual health is taking care of your overall health. Take care, be well, and I'll see you in the next video.